Okay, so Moira's going to give me the signal when I have to stop, so I'll try and get through it in the time I've got. So what I want to do today is to problematise some of the issues around policy frameworks, plans that we have that drive prevention in Australia and particularly in Victoria. And by that I mean to challenge those kind of those people who are involved in this work to think critically about it and to think about continually transforming the way we do the work rather than being sort of stuck in, you know, this is the way, these are the rules, we'll just follow them without too many questions. Policies, frameworks and plans are not written in stone. They give us ways of thinking about our work and about how we go about it, but they should never eliminate opportunities to develop new knowledge, ideas and ways of doing things. So just a brief overview of what I hope to cover in this period of time. To discuss with you some ideas about approaches to prevention of violence against women work, particularly a feminist approach and a public health and health promotion approach. To talk a little bit about prevention of violence against women in Victoria, because I keep hearing from people, oh, you've got so much happening in Victoria, it's fantastic what you're doing in Victoria. I want to talk a little bit about evaluation and then end up with some questions for reflection, which hopefully you'll be able to address in the discussion sessions this afternoon. So just to start off with, to be really clear about what I'm talking about, we have plans at this national and state and territory levels. What a plan can be defined as a detailed proposal for doing or achieving something. A framework, most of you will be familiar with the Vic Health framework, which has been very widely published and used throughout Australia, which is defined as a set of assumptions, concepts, values and practices that constitute a way of viewing reality. And a policy is, simply put, a course or principle of action. So the policy development process is about looking at what is, what should be, and developing a way of framing how to get to what should be. I suspect that most of us who work in prevention of violence against women work would call ourselves feminist or pro-feminist. But are we really clear about what that means? Feminism is a broad church. It means different things to different people. So I think we need to ask ourselves, what do we mean when we talk about a feminist approach? We talk about feminist theory, but how many of us are familiar with feminist theory as opposed to feminist activism or politics? Because they're not necessarily the same thing. And I think that they go hand in hand, that it's really important for feminist theory to be explored and developed in the academy and to inform practice at a political and activist level so that the two are working together. So in thinking about feminism, how do we understand and articulate understandings of power in our work? How do we address intersectionality, the ways in which multiple social categories, for example, race, ethnicity, gender, sexual orientation, socio-economic status, intersect at the micro level of individual experience? I know that I have to be really careful when I work in the community about using the F word, because it's not a word that's always welcomed and people have all kinds of stereotypes and overlays about what it means to be a feminist. You know, you're the humorless person who wants to take the fun out of life. I also know that as a post-structural feminist, my understanding about the operations of power are probably somewhat different from those of a radical feminist. And I only draw attention to this because it's such a messy business and we don't have the kinds of discussions and debates that we need to move forward in this project of preventing violence against women, a goal that we all do share. So I want to look a little bit at what underpins this work, because we talk very easily about primary prevention, but how many of us actually have that deeper understanding about where it comes from and how it's being used? The public health disease prevention model is one where we get the 3 levels of prevention of violence against women. In disease prevention, tertiary interventions are concerned with treating disease. The Ebola crisis in Africa is a really good example of a tertiary intervention. Secondary interventions involve the earliest possible identification of infection or disease so it can be more readily managed. And using the same analogy, if West Africa had better health services and better resourced healthcare programs, the crisis might not have reached the stage that it is at now. Early diagnosis and treatment would have reduced the death toll. So primary prevention in the public health model involves interventions which decrease the risk of disease occurring in the first place by removing the vectors of disease and introducing things like clean water, safe food handling, immunisation and so on. So we have to ask ourselves, is violence against women a disease? What does it mean to do this work in a social setting? It's somewhat different. Health promotion is the discipline through which most of the, even if you don't come from a health promotion background, if you're using primary, secondary and tertiary, you're using a health promotion framework for your work. And this is a really effective way of approaching lifestyle practices, which often have social backgrounds, and getting rid of the risk factors, for example, controlling cholesterol through to reduce heart disease, reducing smoking to reduce the risk of cancers and so on. None of these areas are without their critics, and we don't often have these debates about what the critics have to say about health promotion and public health. So just as a taste, Lupton, who's an Australian academic, criticises the manner in which public health is accepted by practitioners without an appreciation of how concepts such as knowledge, power relations, society and the human condition have come to be understood in the humanities and social sciences. So this, opens up a way of starting to debate, are we using the best possible approaches or are we learning and adding to the approaches that we use? So just to go back briefly to health promotion, it's a relatively new public health discipline. It grew out of health education in the 1980s when the social model of health was developed. It recognises, the social model of health, that health is more than the absence of disease, and in many cases, ill health has a social underpinning reason. At around this time, the discipline of health promotion was born. It focuses on identifying and eliminating risk and promoting healthy behaviours. So you can start to see how health promotion is actually really useful in thinking about addressing an issue like violence against women. It includes strategies such as education, social marketing, community action, organisational development and cultural and environmental change, and it uses a settings-based approach. So settings are places where people live, work or play, where messages can be widely disseminated, such as schools, workplaces, faith communities, sporting clubs and so on. So there are some critiques of health promotion. And partly because practitioners come from such a wide variety of backgrounds and disciplines, they may not have this kind of understanding of what underpins the work that we're doing in preventing violence against women. And so the debates aren't happening. So as Michael Floyd explained this morning, for violence prevention of violence against women, that quite complex public health model has been reduced to 3 kind of almost throwaway lines that we work for safety and support. The response sector is about tertiary interventions. Secondary is taking action at the early sign of violence, and often put in context of working with men who are perpetrators. And primary prevention is about stopping violence from occurring in the first place. Now, I think we need to have much more discussion and debate about what those different levels actually mean and how we do them. They're almost throwaway lines that we've kind of reduced it down to, and they've got stuck. They haven't shifted in the 10 years that I've been doing this work. So I'd like to see us talking about it a lot more. Okay, so in Victoria, one of the reasons I think that we've had so much publicity and so many programs in place is because of Vic Health. The Victorian Health Promotion Foundation, which is funded by tobacco taxes, has a lot of money to spread around prevention of ill health. And in the early 2000s, some really interesting work happened at the policy level between community activists and public servants around what needed to happen to introduce prevention of violence against women. So initially Vic Health had a survey which identified that the biggest impact of mental health on women was the experience of family violence. And so using that evidence, they really set in place a process that said, how are we going to ensure that women who experience violence have appropriate responses, and what are we going to do after that? And so initially, from around 2000, Vic Health collaborated with government and with the women's health movement in Victoria to work with people from the response sector to really mend what they identified as, at that time, a broken sector. There wasn't enough funding going in. People in government weren't really understanding what was needed for the response sector, and there was a really kind of angry, confrontational environment being set up. They moved past that through a process of continual meeting, discussion, and working over it. And as a result, in, I think it was 2005, Vic Health launched their prevention policy. And really, in the last 9 years, have worked very hard to make that policy something that has been rolled out in the community, using this public health approach and looking at different settings and what kind of appropriate programs need to be put in place in those settings. Okay, so most of you are familiar with the ecological model, and Michael Flood mentioned it this morning. This was originally developed for a whole range of other prevention projects. It's been adopted by the UN and in Victoria by Vic Health, and I think Michael already described this morning how working at those different levels is really important, that it's not just one or the other, but making sure that programs address the different levels of that model. So the ecological model suggests that the problem of violence against women is essentially one of culture and environment, rather than one of deficits in individuals. The premise of the model is that violence is a function of the abuse of power and control. So it's been strongly influenced by feminist ideas about violence against women. You can see it written all over the place. So solutions involve, as we've already been discussing today, changing social norms and behaviours that require the active involvement of all levels of the community. So basically, Victoria's seen 7 years of prevention of violence against women activity. And initially, what they did was introduce a range of very small projects. I think that they were around $5,000 each in the community. They evaluated those projects, and then they looked at the ones that were really effective and scaled them up so that they became longer-term projects. And there is some really great reports from Vic Health that describe how those projects have worked and looked at, you know, the key learnings that can be transferred into other settings, and I would recommend those. One of the things I think that's really difficult is how vulnerable policy work is to political changes, not only at a government level but in organisations as well. So about 18 months, 2 years ago, the Vic Health Board changed and they developed a new strategic plan, and from being one of its top priorities, prevention of violence against women has now been pulled back, slotted in underneath mental health, and is much less resourced. Now, in fairness, what Vic Health have done is pass a whole lot of that work across to Our Watch. Lara Fergus is going to talk about Our Watch later on. So it's not that it's been dropped off altogether, but the very significant resources that did come from Vic Health into community programs has diminished, and it's not clear where that's going to happen. Now, something very similar happened in 2009. After that process that I was talking about, repairing the broken system and developing a prevention policy, the then Labor government introduced, just a few months before an election, a brilliant policy called A Right to Respect, which was a true prevention policy, and probably the only one in the world, for government and community that looked at how to embed prevention in all kinds of work. Now, the election came and that policy was dropped. Now, it's not that that the new government has not continued with a commitment to preventing violence against women, but they have been a lot more focused on the response end than they have been on prevention. I'm told that there's a new prevention model, prevention program coming out, surprise, surprise, just before an election. So all of this work is really vulnerable, and I think we have to keep working to ensure that we make it something that is not easily knocked off the table and well funded, and because it's quite clear to me that for policy to work well, it has to have money behind it. So for those public servants in the room, I really implore you to go back and do as Prue Goward said, develop policies that won't let politicians off the hook. It's very important. And I'll finish there. Thanks very much.